define food deserts as large geographic areas that cluster that have no or distant mainstream grocery stores. And it's a block by block analysis.
As I speak to you today, there are food deserts in the city of Detroit that we created to help essentially provide the healthy food that was not found in the local supermarkets. And it's still a challenge in that community, and I know that it remains a challenge in many communities throughout this great state. It's my pleasure this afternoon to introduce someone who is a kindred spirit and essentially shares my passion. Mari Gallagher. Mari is, first of all, a graduate of UIC. I think she needs a round of applause for that. Mari was the recipient of a 2009 UIC Alumni Association City Partner Award for outstanding contributions to the vitality of the Chicago metropolitan area. She's not only active in the UIC community, but her presence is felt throughout Chicago. And I just learned, as we were talking prior to the formal introductions, that she was also a consultant for, I believe, some of the work that was underway in Detroit during my tenure there at the University of Michigan. But one of the most recent projects from her research and the consulting group dealt with this issue of food stamps, and the issue of whether food stamp retailers are helping or hindering public health and economic development in our most troubled neighborhoods. Her research provides essential details needed to understand and address the extent of what I refer to as food deserts. She's identified affected populations and has mapped out these neighborhoods by name, street, aldermanic, ward, etc. Her aim here is to help Chicago residents identify retail stores authorized to accept federal food assistance money and to determine whether these vendors are or are not providing sufficiently healthy and fresh produce. You know, the whole issue of the provision of healthy food and produce to local consumers. So she's here today to present, and I hope I have the title right, and I hope you've not changed it, because that's happened to me on occasion at other events. From Food Desert to Food Oasis, the next 5 years. Mari Gallagher, a member of the UIC family.
Wow, I'm so thrilled to be here, and I do feel very much part of the UIC family. UIC has been very, very good to me over the years, and I appreciate the Chancellor's support and the professors who actually put up with me while I was here, so and continue to be my friends. So thank you, and please continue enjoying your soup if you still have any left. I see I had it last time I was here. It's delicious. So it's such a lovely venue, and it's whoop. We may need some technical. We are stuck here. We are frozen. Wow, frozen in time. This is where I use the time to talk about how great UIC is and WBEZ, CAN TV. Yeah. Whoa. So what kind of soup do we have today? I didn't see what they were making. Did they? Anybody? No? Thank you. All right. I was sort of prepared to go on without it, but I do have a couple interesting photographs for you. How many people were here last year when I came to Rethinking Soup? Oh, okay. Okay. So I have some new information, and I have a few of our original slides. As the Chancellor mentioned, we did a report in 2006 examining the impact of food deserts on public health in Chicago. Last time I was here, I told you a lot about our work in Detroit. I actually did a TED Talk that you can find the link to on our website if you want to see some of those slides. I have a couple update slides for you. And I think last time I touched a little bit on Savannah and Birmingham, some work we did there. But today, and it's interesting, our chef has roots in Cincinnati. We did a project in Hamilton County, which includes Cincinnati, and found some interesting things about the food stamp program, or the SNAP program. So I want to share that with you. But to begin, 90% of the diseases known to man are caused by cheap foodstuffs. You are what you eat, and that sounds like something out of Fast Food Nation, but it's actually a pretty old quote, goes way back. So that's really a good part of our discussion here today. We are what we eat, and so we're enjoying a nice meal right now. Many people don't regularly have that available. And what we want to know is, to what degree does what we eat, and thus our health, depend on our food environment? So that's pretty much the crux of our aim in each research project that we do on food deserts. Sometimes we do projects, we don't even use the phrase anymore, food deserts, but looking at the relationship between food and health. And frankly, it is complicated. Many factors influence health, genetics, income, race, education, so on. What we're specifically looking at in our studies is the location of different kinds of, primarily retailers, but other kinds of options that regularly provide food, and then the balance of those choices too. What's the food balance? How far do you have to go to reach the healthy place over the unhealthy place, and so on. And then we're trying to see if that has a relationship on your health, controlling for other factors that we can. So consider where you live. Is it just as easy to buy skinless chicken as fried chicken? Can you choose fresh fruits and vegetables as easily as soda and candy bars? And many of us that live in neighborhoods with lots of different choices, we find it hard to believe that sometimes, out there in other communities, it really is hard to find something simple like a banana that doesn't look like it got into a fight with another banana, for example, or produce that doesn't come out of a can. I may have told you this last time, but it's still moving to me. When I did work in Alabama, I actually met children that had never seen grapes or strawberries. So it's amazing. I think a lot of times we take some things for granted, and certainly we need to do more than just provide access. The problem is not solved when we provide access, but we need to look at the kind of foods that are in our environment. And we developed a line of work called the convenience food factor, which means generally people choose food closest to them, even though they might prefer or medically require healthier but more distant food. And we've identified two categories. We look at a lot of different things when we do these studies, and we understand there's many different kinds of food options. There's supermarkets, there's convenience stores, there's fast food, there's all different kinds of things. There's alternatives to the retail option. But what we do in each study is we identify the closest mainstream food provider and the closest fringe food provider, and those are terms that we came up with to kind of understand if there's a healthy choice or not. So a mainstream food provider, it doesn't have to be, it certainly doesn't have to be a superstore, it doesn't have to be a supermarket, it doesn't have to be a chain. It could even be a corner store, and there's a corner store movement going on now across the country. So it could be a corner store healthy movement, that is. It could be a small store, as long as it sells enough healthy foods that would support a healthy lifestyle on a regular basis. A fringe food location is the opposite. It's not inherently bad, but if it's your primary source of food, chances are your diet and your health over time will suffer. So we look at those two different kinds of food options, and we actually do a lot of work in the field and spend a lot of time coding, is it mainstream or is it fringe? And so we do this for a study area. So let's say Chicago. Chicago did, before the last census update, have 18,000 plus non-zero population blocks. They truncated some of the blocks, so now there's a lot more. But if you think of the study area and all the blocks that have population, you want to study those, and then also a buffer zone around it, because people might cross the border of Chicago or the border of Cincinnati or the border of Hamilton County and shop for their food outside, because we're not confined by these political or municipal boundaries. So that's generally all the data that we collect. For every single block, we do everything at the block level, and we hear this term food desert. I get a Google alert every time somebody uses that phrase, and a couple years ago I received one that said, someone's blog. I'm in a food desert. Whole Foods doesn't have my favorite sushi anymore. So there's nothing like taking a term a little bit too far. But we define food deserts as large geographic areas that cluster that have no or distant mainstream grocery stores. And it's a block by block analysis. So if you're interested, for example, in Inglewood doesn't exist in isolation. Certain blocks in Inglewood don't exist in isolation from the surrounding. We really need to look at all of Chicago, the whole surrounding area, and really understand the universe of the data, the patterns, because we all exist in relativity, to everything else, right? So we need to look at the whole thing. So it's a detailed calculation that we do, a lot of mapping, and but that's the beginning of how we identify food deserts. Food balance is a term that we developed, and it just asks if you can easily choose that one kind of food versus another. Can you choose mainstream as easily as fringe? So I'm going to explain a little bit how we do that, but let me just give you some visual examples. So again, this is a question I asked you earlier. Can you choose an apple as easily as a candy bar? And of course, in some areas, this is the food environment, right? Lots of fast food, ketchup, it's a vegetable, supposedly. But, this is food imbalance. So many neighborhoods actually, have a great concentration of food. It's just not that healthy. So these are examples of some of the places where you might go to buy food if you live in a food desert. And of course, we have these kind of places elsewhere too, right? We have, people go to dollar stores and they, go to the gas station, mini mart. But in some areas, it really, the reason why the food desert metaphor kind of holds is the idea that you have to make such an effort, right? You're going to go across a large area to try to finally reach that oasis. So sugar. I'm going to be talking about death soon, so I like to make everybody happy. That's just a fun song, so I just try to keep people's spirits up before I get into the real heavy stuff. But sugar is, in many respects, the new street drug, and we have a lot of sugar around us everywhere. Yeah. How many of you have a double gulp baby at home, huh? Maybe they bought it at 7-Eleven. It came out of that plastic container. That's some new material I'm working on. Just in case the research thing doesn't work out, I may have to do the comedy full time. But we do try to actually laugh in our work because a lot of what we find is pretty heavy. Again, when you meet kids that have never had a strawberry, or you see neighborhoods that are so devastated. But how do we get to our findings? Well, there are a lot of steps involved, and our first step is to basically, again, go to every measure from the center of every block, non-zero population block, what the closest everything is, and then also code that into mainstream and fringe, and develop that robust data. Any retailer in the SNAP program, we will categorize as either mainstream or fringe. So, for example, there could be some gas stations have little mini marts. If the mini marts are in the food stamp program, we'll decide is it mainstream or fringe. For the most part, those little mini marts are fringe, but you have to give the benefit of the doubt and go see. If it doesn't sell food or it's not in the food stamp program, we don't grade it. There are some cases where conventional full line supermarkets, even smaller independent ones, or healthy type food stores that really are mainstream do not accept SNAP, and in those cases we do count that in the data. So there's a lot of data development, and we go through the data and develop a lot of empirical scores. I'm going to go through some of these slides quickly because we have a lot to cover. But the point is that we do compare all this food environment data to health outcomes, controlling for income, age, race, and education. And we've since our Ohio study, we're just finishing a study now in DC. We are publishing all of our regressions in Excel spreadsheets online, so some of you can't sleep at night. There's more stuff to put you to sleep on our website. So I'm going to show you some stuff in a little bit from Cincinnati, and we have that data up there. But first, a little bit on Chicago. How many of you have been following the food desert situation in Chicago? Anybody? Okay. So in 2006, we came out with this map. There were over 600,000 people in the food desert. And we also started talking about food balance and food imbalance. This picture, though, was later developed, inspired by some work we did in Savannah, and particularly some of the statues there you see in the Midnight and in the Garden of Good and Evil book. But we thought that this whole thing about balance is really it doesn't roll off the tongue like food desert, but can you choose is really an important question. I'm just going to take a moment to say how we come up with that score. So in our maps and charts and things, red is bad, blue is good. Not a political statement, just the colors that we use. I've learned, especially traveling through the South, to explain that, not a political statement, but just so that people can kind of follow along. So a score of 2 means the healthy food, the closest healthy food from the center of the block is twice as far as the closest unhealthy food. And there are neighborhoods throughout our country where the scores are 10, 15, 30, things like that. So there are many neighborhoods. We're not even talking now about the high concentration of fringe, right? Because you can have a block and 3 corners can be fringe and 1 corner can be mainstream. We're looking at the closest type of stores, so the score is still 1. So the concentrations can even, be much more pervasive. But we're just asking, can you choose? How hard is it to choose healthy food? So this was a chart that we did back in 2006, and you can look at the icons, so I won't read it for you. But you could see that for majority African American blocks, that they travel almost twice as far on average to reach the healthy over the unhealthy food. So that would say that those blocks have food imbalance. And of course, there's a range of data, so not everybody's around 2. Some are a little better off, but many are much worse. So this was some work on body mass index by zip code, and just to go through it quickly, basically pairing it with food balance or food imbalance, you can see how the red and the little black dots line up. Basically, we found that putting in a mainstream grocer in Chicago reduced body mass index even more than taking a fast food place out. So that was kind of an interesting finding for us. So that kind of reinforced our question, can you choose? And I know many people are focused on getting rid of fast food. It might be more productive to focus on bringing in healthy food. And at the same time encourage fast food to improve their offerings. So with our first study here, we found a statistically significant relationship with diabetes and other kinds of correlations, and I'm not going to go into all those now. I'm just going to touch on a couple things that we did. There were some other things too, and many people were involved, but we worked with Mayor Daley at a grocer expo. We invited some CEOs in, and I want to emphasize, sometimes people look at our work and think that we're saying the answer is a chain grocery store or, just as, some kind of supermarket. There's many different flavors of mainstream, but we did feel it was a good idea to get the retail community paying attention. And now you see a lot of different people today paying attention to the food desert, doing all kinds of things. I just got an email from somebody the other day opening up an organic mobile juice bar, or trying to, they're in the food desert. So many different things that we can do, but it was also a good idea, we felt, to get the attention of the retailers. You could say food desert, you could even say to dessert, right? There was some desertion of many of these neighborhoods where grocers had moved away. So we helped the city prioritize some sites. This was in 08, so most of those sites have grocers or they have them nearby, and so these aren't the sites now, but the whole idea is that if you use data to prioritize resources, it's a pretty good idea. And we came up with some impacts, so basically impact measures for these prioritized sites. We also worked on a metric called years of life gained. Many of you, especially those, do we have anybody from the health department or doing public health of any sort? No? One break.
I'm a nurse.
Oh, okay. So you have probably heard of years of life loss. So years of life loss means how much more premature death is there from a certain cause after you control for other things, considering that we will all die someday. Again, this is why I have some happy slides in here, because a lot of my message is kind of a downer. But So we will all die someday, but to what degree does our food environment contribute to speeding that process up? So we spent a lot of time talking about years of life lost and saw a lot of sad faces. We showed the little girl with the cup and played the music. Still people were sad. So we realized, maybe there was an opportunity to, instead of talk about years of life lost, talk about years of life gain. So we kind of worked the metric a little bit to, instead of looking behind us at at the life lost, we could look ahead and say, if we did something today or tomorrow, over time, what could the public health return be? So that was very positive. And this is a picture of our former health commissioner, Dr. Terry Mason. And I was talking to David Merriman, telling him about the National Center for Public Research that I'm a part of. One of the things that we did was raise some money. All of it went back out into the community. We received donations as well. We had National Food Desert Awareness Month for 3 consecutive years. We actually suspended that campaign because I think most people have heard the term food desert. So it's good to know when to start something. It's good to know when to end, at least that campaign that is. I think people have awareness of it. But he went out with us on a very hot day in August, and we passed out 10,000 pink pearl apples in Roseland. How many of you know the Roseland community? Anybody? Okay. Anybody here from Roseland? Okay. We had many folks come out. You could see they made signs. This, again, was a volunteer effort trying to attract people with grocers or other kinds of food options into the community. And actually, Roseland was one of the sites that we identified as a priority site, and we projected that if a mainstream store located at this particular site at 115th and Michigan, that it would impact 24,000 people with better food access, and it would collectively reduce. Again, this is years of life gained, right? So it would reduce. It would give back 13 years from liver disease. Obviously, other things contribute to liver disease, so controlling for other things. 15 collective years for diabetes. Does everybody know what I mean by collective? It's sort of like if we're Roseland, it could be I get 2 months back and you get 3 months back, and it doesn't affect you and it affects you a little bit, and then we add all that up. We're the one community, and this is the 15 years. Okay. Cancer by 58 years collectively, and cardiovascular disease by 112 years. So when we think about public resources and how they're used, we know that every project matters, and that means everything that you do, everything matters. And when we think about public resources, we have to identify how much do things matter, and what is our lens for measuring what matters. In this case, we're suggesting public health as a lens. There are other lenses too, jobs and things like that, economic development. But we should use neutral data and information to award incentives and resources to those projects that matter the most. But never doubt that your projects matter. And we can understand that spiritually or philosophically, and we can actually just show you mathematically that they do. So know that they do. Now, for Chicago, in terms of tracking change, we can see here from 2006 on, and I won't go through all the numbers, that the food desert has been shrinking. It's been shrinking in terms of its actual size, and it's been shrinking in terms of population. Some of the population reduction in some instances, and we should probably just call out the number of like what exactly this is. It's certainly not the whole gain. But it's a small part. Has to do with, in some neighborhoods they lost population. But we have seen a shrinking of the food desert. So the land mass has gone down, and the persisting population that's persisted has been taken out of the food desert. And that's by almost 250,000 people. So that's good reduction. So we think that data can help track change. And as you know, we have a new administration here in the city, and this is our new mayor, and he's been fighting pretty hard on the issue. We actually think that the food desert can be reduced much sooner. And we've gone out on the line publicly to emphasize that, especially if you use data to drive, where these new mainstream solutions, end up going in, and they end up attracting competition, right? So they attract other people going in, so it creates kind of a catalytic effect. So once they go in, though, we also have to work on helping them stay in business. Make sure that these businesses are sustainable. And make sure we're not giving too many incentives away. We need to be smart with our money too. But nonetheless, we still have a fairly serious problem here in the city. This is our current food desert population, and when I first looked at these numbers, I realized you could. Anybody here into baseball? Anybody like to see the Sox play at the so-called Saginaw Field? Okay, so you could take, let's just call it Sox Park. You could take Sox Park and fill it up 10 times to capacity with all the food desert population. So next time this summer when you watch a ball game, you can remember that. So hopefully the numbers will be going down. Maybe that's how we should keep measuring it, right? How many packed stadiums we can do, or get rid of, turn into an Oasis. So we recently came out with a drill down, and I know some of the announcement or how the talk today was described was about the SNAP program, the Supplemental Nutrition Assistance Program, formerly called food stamps. And I want to make sure it's clear that we think it's a vital program. It's a very, very important program. With any important program, sometimes you can find resources that could be a little bit better used or maybe a little problem. So know that we think it's a vital program, and it should, most definitely continue, and it needs more money. We just need to make sure that we are using that program wisely, and sometimes it's our most vulnerable neighborhoods that that suffer, or where the program might not be living to its fullest. Remember, the USDA uses the tagline, "the first line of defense against malnutrition," to describe the SNAP program. Now, these are the redemption patterns. If you saw my talk last time, those 10 of you, I think, that raised your hands, that I showed you some examples, and I'm going to show you a little bit about our work in Hamilton County, but I showed you how like these redemption totals may not, the total, it's almost $1 billion, so that total is correct. However, the things that are identified as a supermarket, those retailers may not always be supermarkets. The ones, in Detroit, some of you may remember that we recoded 52% of the convenience category in Detroit into liquor stores. So, when you go out and spend a lot of time in the field and you make all the phone calls and you go and see what people are serving, or if it's called like Mari's Liquor Shack, sometimes that's a clue. It's really, it's listed as a medium grocery store, and it's called, Happy Jack Liquors, or something. Sometimes that's a little bit of a giveaway, but it's really important to code these things correctly so that we can understand where the money is flowing. I do believe that the majority of funds do flow into legitimate type of stores. The problem is, in many of these underserved areas, these food desert areas, you might have 10 different kinds of entities in the SNAP program, and maybe all 10 or maybe only 9 of them qualify, and 4 of them could be a liquor store. And I'm not against liquor stores, I'm just asking, is it part of the first line of defense against malnutrition? And this is a very important economic development engine, and we should use carrots and sticks to get these stores to step up, because retail attracts retail and like attracts like. And so when you have a market that's bottomed out, it's going to attract more of the same. It's harder to turn that around. And I spent many years working with very small businesses and working to revitalize local business districts. It's very hard work to do. And the great thing about a mainstream food option is it attracts other kinds of good retailers to the street. So think of it also not just as a public health engine, but economic development engine. So now remember, this is almost $1 billion. This was last year. So in this drill down, what we did was we picked out, I think, 11 or 12 high-profile sites. So I'm sure all these people appreciate it. So like Mayor Emanuel, where he lives, and there were some other sites too. A lot of different things. The Roseland site that I talked about, and so there were like 12 sites around the city. One of the sites we picked out was Chalmers Elementary School, because the Fresh Moves, and I heard somebody talking about them earlier, what a great program, freshmoves.org if you haven't heard of it. So they have like a mobile store, and they're going into these underserved areas. So we thought, well, wow, I wonder what their competition is within a half mile. So now some of these half-mile areas might have, like we did Congressman Rush's office, I think he had like 12 or 13, like some have a greater number of retailers, but there were 4, so I thought, well, that's interesting. Let's today look at these 4 retailers. So these are the 4 that come up in the data. So I know many of you are students, and I get lots of emails from people. I'm so passionate about food and health, and you know, sustainability. I want to work on this. So here's an idea of something that would make a great, you know, master's project or research project, or just something that you may want to do to follow your passion. So it's pretty easy to do. So we looked it up in the data, and you can go to the SNAP locator. More and more data now is available online. We used to have to pull teeth to get some of this data. Now just just Google SNAP retail locator or something like that. If you have trouble finding it, send me an email. But we used to really struggle to get all the data in the spreadsheet, and now a lot of that is downloadable. Unfortunately, a lot of the information that we find tasty is not within it, but nonetheless, you can find some of the names of the retailers. So these are the 4. So let's look. Now, this is just actually using Google Maps. So really, I want to emphasize these pictures can also be old. It really is important to go out and see what's there. We usually pull a sample. We do a lot of different things, and then we go out into the field. Like I said, I just finished a project in DC. I spent a lot of time going to some very interesting places in DC, but you often have to go inside and look around and be prepared to shop, like specifically go in to find things like, produce and see what condition it's in. So this is that store. Let's see it a little bit closer. I'm sorry, I came from another conference, so I think this is kind of fun sometimes just to call them up and, do you have banana, do you have oranges, do you have bananas? So I haven't actually called to see if they do have produce. Our experience generally in doing these studies is just, and by the way, you can see this is a different name on the awning than it was in the data, right, the data listing. So I don't know, honestly, if they have produce or not, or what the condition is, but I'm just giving you some examples of where you can start. And actually, you can take a look at our website and go to the addendum for the Food Desert Drill Down addendum, and we list the verbatim data that the USDA provides for these half-mile areas by these high-profile locations. So this would be a neat little project for some of you, and let me know how it goes if you decide to embark on it. But so I'm not saying this is, don't judge a book by its cover, but these are what the covers are showing us. So this is the California Food Mart, and then this is the Prince Food Mart on Roosevelt, and then we've gotten a little closer up here. And this is Roosevelt Food and Liquor. Sometimes what's fun is just getting your hands on all this data, and it could be thousands and thousands and thousands of records, is just start running searches for the word dollar or the word liquor. Again, you got to be careful about interpreting what that means, but it does kind of give you a sense of what you're looking at. So then we got a little bit closer up. So remember, retail attracts retail, and like attracts like in either a positive or negative direction. We should think about our resources and the types of retailers that we're saying are the first line of defense and part of an economic development engine. I mean, it is tough if you're a mom and you're in some of these neighborhoods. Many of these stores, even the liquor stores, provide convenience, but to have to go into a liquor store and maybe step over drunk to get your kid a gallon of milk, and then you can't buy skim milk. I mean, these are I feel that sometimes people say, well, we shouldn't tell people what they should buy. That's true, I suppose. But all programs do have some type of requirements, and we should just call it what it is. And so many of these stores, based on how they're coded and based on the rules, don't line up. So we need to take a hard look at that, which is what we did in Detroit. And I showed you, I think, I went back to the presentation I gave last time. I think I had 15 slides on Detroit, so I only have 4 now, and 2 of them are new. But this is the old slide. Remember, I was saying that we've been recoding the data. And so, remember, red is what is red? Red is bad, and blue is okay. And it's not a, oh man, I gotta warm you guys up a little more. To think I'm almost at the end. Oh. All right. So after we recoded all the data, we found that most of it, and this is from memory now, I think there was something like 1,300 total SNAP, it wasn't called SNAP then, SNAP participants in Detroit at the time we did the study, and the little blue bar were the ones that were mainstream, and some of them were kind of borderline. So you can see kind of who's in the program. 92% fringe, 8% mainstream. So one of the new developments is that more and more fast food establishments, some have kind of snuck into the program, but now they're lobbying to officially be in. So there's a big fight on about that. Yum Brands just recently gave up and pulled out. I think a little bit to do with some of the research that we came out with. But nonetheless, so we see that Detroit, before we found a lot of kind of specialty shops and buy and fry that were in the program that weren't supposed to be, but they basically said, well, if you buy it, it's like you're at a store and then we'll fry it and we'll charge you a surcharge or we'll give you the frying for free. And so we found a lot of marginal type places that kind of looked like Popeye's chicken. They weren't Popeye's. And I don't have those pictures here, but check out I think it's in the TED Talk. We show some different Detroit things in the TED Talk. But now you actually have the fast food places saying, we want to just be part of the program, officially. So it's a concern to us because in the studies that we've done, we didn't look at this in Chicago, but like, for example, in Alabama, we found a statistical relationship between fast food and the USDA fringe ones and more death, things like that. So we're, and dollar stores and more death, and these are all official SNAP stores. So we're concerned about that. The first rule of medicine is, like do no harm, so first do no harm. So on that note, let's talk about Hamilton County, Ohio, which, like I said, it's a tri-state area. I encourage you all to go there. It's like about a 5-hour drive, very lovely. There are some underserved areas in Detroit, in Hamilton County. So you can see here by the chart, I won't read it for you, but we found some very interesting and unfortunate relationships between all of these food patterns and worse diet-related health. Again, between dollar stores and more death, after control for other things, food stamp dollar stores, all different kinds of things. And interestingly, we did not find this in Chicago, but in other places we find relationships to things like cancer. After you control for other things like cancer of the esophagus and lung cancer, things like breast cancer can be contributed to from smoking and diet. So there are complications. But after you try to get out the types of cancers caused by things other than diet, we find relationships. So a lot of different relationships we found. I'm going to kind of move it along a little faster, but it's not always a black and white situation, but we do find that in many cases people who suffer are disproportionately of color. We generally find that there's more fringe than mainstream. We do expect that, but the question is, what's the patterns? There will always be more fringe. It's going to always be easier for smaller, type convenience stores and so on to open than supermarkets or mainstream stores. So the question is the distribution. Okay, so I've got 5 minutes. And I'm going to end, not yet, but within 5 minutes, sharing some of what we found with these SNAP patterns. So we archived a 2006 database by address of all SNAP stores across the country with these internal codes that the USDA used to provide, which they don't anymore, but it's very historically useful to us because we've been lining it up with current data, trying to figure out what the trends are. So in Hamilton County, Ohio, and anybody been to Hamilton County, Ohio, besides our chef? Okay. So that the city's very urban and the rest of it is very rural. It's a very interesting, bluffy place. But you could see that the entrance into the SNAP program, gas stations, dollar stores, pharmacies. We have some issues with pharmacies. We're glad to see them provide healthier food. We don't think many of them qualify nonetheless as mainstream, but there are more supermarkets, but you can kind of see what some of the patterns are. So we're seeing a lot of pharmacies, dollar stores, and gas stations. And then we did some comparisons. We don't have a lot of time to talk about everything here, but I just want to point out, supermarket and bakery. So somebody can look at this and say, well, yeah, there's a lot of different entrants, different retailers in the food stamp program, but look, most people spend their money at supermarkets, but remember that coding problem that I told you about? Not everything that's in the supermarket category is coded correctly. But even just looking at the comparison between supermarkets and bakeries, if we just compare them as a percentage to the total amount spent, the bar is so small you can barely see it. But if we do it by square foot of establishment, you see, it's a little bit more. And you have to figure too that probably some of the money that's categorized as supermarket doesn't actually belong there. So the point is there's still a lot of money being spent at what we would call fringe establishments, like a bakery. And I like a yummy birthday cake as much as the next girl or occasional, cupcake, things like that. I don't think it's part of the first line of defense. Does anybody agree with me that we should be having, you want the bakery as you agree?
I can tell you
okay.
why. I can tell you why.
Oh, we'll do it. I'm almost, yeah. Okay, I'm sorry. So these are we went to the stores and these are some pictures of moon pies. So we're not demonizing bakeries or suggesting death by cupcake. Okay. But in 49,000 in a 9-month period, this was for a 9-month period, these are mostly mom and pop shops. There are some day-old places, like more slightly bigger establishments, but actually looked up which ones they were. So this is kind of a let them eat cake mentality. Now, it's not intentional, I'm sure, but it's the effect of that. I mean, there are some families, if you can just run down to the bakery, and most of these bakeries that I went in, some of them do have bread, but it's not necessarily, multigrain. Some of them don't have, it's mostly pastries and cookies, okay? We've all been to a bakery, you know what I'm talking about. So now, we didn't have the data to analyze the dollar stores and gas stations in that same way, but I'm telling you there's a tremendous growth of dollar stores now in the food market. And it makes us very concerned because of the types of food that they're selling. We still are categorizing most of them as fringe. So Family Dollar has just recently reported a huge jump in what they're calling consumables, which is mostly the types of things that grocers sell. So it's kind of going up and up. So this is one of the examples in Ohio of one of the food stamp retailers. This is actually a beauty supply store, but they were making a delivery. I mean, you see some odd things. This is not the norm in Cincinnati, but you do find some odd things all around the country, and the Woodlawn pony keg and so on. Now with Detroit, stay tuned for that. It's going to be on our website hopefully soon. We have found a statistically significant relationship between food access and overweight births. So newborns being 10% more likely to be overweight, which leads to a whole bunch of other things later in life. So we need to think of our food environment, and our food environment does not control our genes, but it can, affect the expression. And this is a map that we came out with in 2006, and we got a lot of resistance on it before we published it. And David was asking me, like, well, what would be the reason to form the National Center for Public Research? Well, one reason is sometimes you come out with information that's uncomfortable to people, and they don't want you to publish it, So, I mean, we were successful. We were able to publish it, but, who's advocating for the public good, when sometimes things are a little uncomfortable. So people thought this would be a very uncomfortable map. I have some things about genetics that we'll talk about when you invite me back maybe next year. Good between now and then. But the point is this your food environment? Is this your food environment? Is this your food environment? Are these the signals being sent to you, conflicting signals in your food environment? Okay, so these things are kind of funny in a sense, but they are. I had fun. I admit it. I had fun putting the little chips together. By the way, Detroit is the potato chip capital of the world. I bet you didn't know that. So that might be their food environment. But the serious part is that it has an effect. And I'm going to bring you into one of those happier slides because I can see some of you looking sad. So being good isn't always easy when that's your food environment. I spoke at the University of Chicago not that long ago. They were so gracious. We had a very nice time. But I looked out after I gave this slide. People there have a lot of beards. Smart people have a lot of beards. My husband has a beard. A lot of smart people don't have beards too. But they were serving these big cookies, and there was a guy who had a big kind of, and I was really embarrassed anyway. But that's another point too, is like, what do you eat? In many of the events that I get asked to speak at, most of the time the food is pretty good. That's increasingly the case. But, I've been to cupcake presentations before. Everyone likes a cupcake now and then and a cookie. But, the question is, when we're all coming together, what kind of choice are we making that can have that impact? And so when we look at solutions, we really have to think of where we can have the biggest bang for our effort. And one great way is to take these corner stores and help them cross over to mainstream. I want to move along quickly now. I want to make sure everybody knows about the familyfarmed.org conference coming up. If you go online, I know there's some student scholarships, and I'm really happy to be on the board, and there's going to be a lot of good panels and so on, so I really encourage you to go to that. I really encourage all of us to revisit hunger and think about it not as a calorie problem as much as a nutrient problem. I think our old ideas about hunger need to be updated. And just leaving people with the idea that the cost of the food deserts will be borne through quality of life, and really many of us will pay in some way or another. And we really need to think about the policy imperative, community imperative, and the market imperative. And I really think that there are opportunities to move away from dichotomies. And I think that's one of the hardest things in this work is, you see it one way or you see it the other way. So there's a lot of different dichotomies. There's the red and the blue dichotomy that I talked about. There's, you could be pretty or you could be smart dichotomy. If you're a little kid in school, you could be rich or you could be happy. There's all these dichotomies. You could be all spiritual. You could be all body. Is it Mother Teresa or Anna Nicole Smith? And I'm saying some of this lightly, but there is a dichotomy. Is it a food desert or is it a food oasis? Is it all, and the thing is there's a range of things going on out there. And we really need to look at the complexity. But even with something, as serious as food deserts and with all the attention it's getting, it's sometimes dichotomized into it's one thing. Is it a chain store? Is it an independent? Is it, it's many, many, many things. So with that, I encourage those of you who are interested in a field like research to follow your, which is to be dispassionate, with your dispassionate passion. And at this point, I had a few more slides, but I think I will end and take questions, if I may.
We just want to thank Mari so much for coming, and we're going to take one or two, but then we're going to also ask Mari if she'll stay a couple minutes and answer any questions that you might have one-on-one. So
yeah, I'd be happy to stick around. So
okay, perfect. We'll take one or two.
Are you fielding them? Go ahead. Or cook.
I was wondering how you account for public transportation.
Transportation?
Yeah, public transportation. You were actually showing my neighborhood up there, but I'm lucky enough to be on Roosevelt Road, and there's a bus that takes me right to the grocery store.
Mm-hmm.
But, if you're a block, you're 2 blocks north or 2 blocks
Right.
south, then you don't have that. You account for that there.
Yeah, we do a couple different things. One thing we do is we
Can you speak into the mic?
yes. One thing we do is we count the households that don't have automobiles. So we have data tables for who are in these low access areas or food, whatever you want to call, whatever label we want to use. So we count the households without automobiles. We also do overlays of the transportation lines. We haven't done that in Chicago. We've done that other places. But it'd be nice to do that here. And then we've contrived a way where you can kind of classify blocks as being, or certain blocks or areas as being, having better access to transportation or, weaker, less desirable access, and kind of look at some of your, your patterns that way. But certainly, transportation is important. And I should point out too that we were happy that we popularized the phrase food desert, but the way the USDA has subsequently identified food deserts we don't agree with. So, for example, this is not about transportation, but it's about income. Like some people think well, if you have a car or if you don't have a car, these are those dichotomies. Or if you make this much money or if you make that much money. So we actually don't, there's about 5 issues that we have with the way their approach identifies food deserts. But one of the 5 has to do with they exclude areas if they're above a certain average income. So, there's all kinds of things that you could look at. Do people have cars or not? Do they have money? Can they order from, some people order from Peapod. Surprisingly, we've done some work with Peapod. They have quite a few families, in the food desert that, and I'm not saying that that's the answer. I'm just saying that the whole situation is fairly complicated. But certainly transportation, if you have to take 3 buses, to schlep to the grocery store, or you can go down the street, to the 3 other places that are fringe, you know, even though with our greatest desires of getting to the healthier place, you know, chances are, so.
Hi, the Chicago SNAP redemption data you cited for 2010,
Uh-huh.
it said it was redacted from farmers markets, et cetera, what does that mean?
It means that we couldn't get our hands on it because the N was too small, so the number of retailers, so say all of us here are retailers, and you have a farmer's market and I have a farmer's market, and if we gave a number for just what we made in total at my farmer's market and your farmer's market, people would figure out kind of what we were each making, so they redacted it. We didn't redact it, it was redacted before we got to it.
I just wanted to make sure that didn't mean that the SNAP wasn't being accepted. Or
No,
used
no.
for farmers markets.
Right, good question. Yeah, and that's a growing area. We're seeing more and more, you know, farmers markets and alternative type places. And Fresh Moves now, I believe that they've already been authorized for SNAP. And so it's good. It's good that, you know, but we just have to work on some of those other areas. You had to.
Yeah, me? I'm sorry, but I'm not exactly clear who we is. Who is we? Are you professorship or are you?
Well, you know, my mother keeps asking me that. Who are you talking about?
Are you being hired by the cities or is this a university project?
So I wear 3 hats. The projects that I showed you is from my firm. So the we is the firm.
Research group.
Yep. Mm-hmm. And then I have an affiliation with Northeastern in Boston. I don't travel there all the time. I go there a couple times a year and guest lecture, and we work collaboratively. And then I also do work with the National Center for Public Research, which I founded, and primarily we're volunteers. So what we do is, you know, we actually don't do a lot of marketing of what we do, but we go at information. You know, we do a lot of you know, educational outreach, and we've done some testing of kids for diabetes in Virginia, and we've done like a bunch of different projects, but we've been pretty low key.
I'm pleased to see Pete's Market opening up at Madison and Western, partially because I'm a customer at one of their other stores and it's close to my home. I'm wondering though, if we're not seeing a new business model. They're coming in 3 or 4 blocks from the edge of a rapidly gentrifying West Loop and a very underserved West Side American population. What if that's something, a new way of approaching it by serving 2 markets?
Yeah, I mean, I think well, Pete's is a great store. I like, and they're in a lot of different kinds of neighborhoods. I enjoy going into their stores. I think today's grocer has to really, you know, be competitive, and the market for selling groceries is much more diverse than it was, and so you have to really think of, some grocers are responding by saying, I have this narrow customer, you know, I want to serve this narrow customer, whether it's on the basis of higher income or lower income. Others, you know, will have a more diversified approach, but up until about 1980, the consumer price index and the producer price index for food tracked about the same, and they started to diverge, and basically what that meant was a lot of other retailers realized that there was some money in selling groceries, either as a loss leader, you know, like Target now selling a lot of food, or, you know, a Walgreens, or a gas station mini mart, or dollar stores, or, you know, Pete's is exploring other, you know, there are among those retailers, there are a group of independents that are looking to, you know, strengthen their niche in these markets, and some have done well and some haven't done as well, but you're seeing a lot more competition overall for the food dollar. But there's different strategies that grocers have to do that, and others have to do that, I think.
We're gonna have to close that.
Okay. I'll be happy to hang around, and I know you have a question about that. Thank you so much.
You guys have a great day.